They are from great importance since they provide health to all the inhabitants of a region. However, there are some sectors that are not as efficient and they must improve in several aspects. The poor quality of services cause serious problems in people, causing irreversible damage or even death. Welcome to the work of English number 3. My name is Emmanuel Maldonado and today I will tell you more in detail how was our health system before the COVID pandemic. Honduras is one of the countries in Central America that invests very little money in health services. It is barely surpassed by Guatemala. However, these low investments result in the same emergencies occurring year after year. Lack of medicines in health centers and hospitals. Expiration of medicines in the stores of the Ministry of Health. Lack of equipment and health personnel in all areas. Obsolete equipment, and worst of all the population completely unattended and far from obtaining the human right of health. More than 1.5 million people do not have access to any health services. Hospitals provide services to 60% of the population. The IHNS insures 12% and the private sector serves 10%. In Honduras, 9 out of 10 people are not covered by any type of health insurance, and it is estimated that 18% of the population, it means more than 1.5 million Hondurans, do not have access to the health services. The hospital and health center infrastructure is deficient. The services are not of the required quality and coverage. Some public centers data from the beginning of the last century and require a strong investment in infrastructure and equipment to provide services in optimal conditions and free of risks. Maintenance is scarce, which has generated the deterioration of both the infrastructure and the equipment. Just to clarify, the country has a total of 6,590 beds available in the hospital system. Only 6,000. 5,059 belongs to the CESAL. 916 belongs to the IHSS. 40 of them belongs to the military hospital and 575 belongs to the private sector. These data represent a number of 9.5 hospital beds per 10,000 inhabitants.
Hello, my name is Eric Lopez and today I'm going to talk about the coronavirus and the first case of contagion in Honduras. Coronaviruses are a large family of viruses that cause illness ranging from the common cold to more severe diseases such as middle respiratory syndrome and severe acute respiratory syndrome. A novel coronavirus is a new strain that has not been previously identified in humans. The new coronavirus, COVID-19, is a respiratory virus that spreads primarily from person to person through small droplets from the nose or mouth, which are expelled when a person with COVID-19 coughs, sneezes, or speaks. These droplets are relatively heavy, don't travel far, and quickly sink to the ground. People can catch COVID-19 if they breathe in this droplet from a person infected with that virus. On March 11, 2020, the Honduran population was informed that the COVID-19 virus had been detected in the national territory. The zero patient, as it was called, was a 42-year-old Honduran woman in a state of pregnancy who was admitted asymptomatic to the country on March 4 by air through the Tocontin International Airport in Tegucigalpa on a flight from Spain. After being under observation in different hospitals and giving birth, the woman and her family managed to overcome the disease. Finally, We must not forget that to avoid the spread of the coronavirus, it is necessary to comply with biosecurity measures such as washing your hands and using antibacterial gel. Thank you.
Now I am going to mention some of the biosafety measures that the health system adopt due to COVID-19. Require using supplies such as masks, disposable gloves, clinical alcohol or sanitizing gel, among other supplies. Send messages prioritizing hand washing, kitchen cleanliness, and personal cleanliness. Promote training for health personnel and non-health personnel to provide care in reception centers. Using laser thermometers and sanitizing gel for people's use. Use communication channels to distribute information and use of posters with basic hygiene measures to prevent COVID-19.
On February 25, 2021, the first dose of vaccine against COVID-19 were applied in Honduras to help health workers in the police sector and even to a part of the workers in the non-police sector. The national plan for the introduction of the vaccine against COVID-19, the government of Honduras had a guide that established which were the various groups. In accordance with the recommendation of PAO and Advisory Council. Vaccination at the national level was carried out in different phases, starting with health personnel on the front line. The vaccination of Haiti was achieved by vaccination more than 5 million Honduras distributed in different priority groups. By receiving this vaccine, all Honduras are protecting their health and their lives. This protection was further consolidated when they received the second dose 8 weeks after of the first dose. Currently, the causes of COVID-19 have decreased thanks to the fact that the majority of the population has at least 2 doses, and the third dose has been to apply to adults. In addition to the pediatric vaccine of children over 5 years of age. Among the different vaccines that have been employed in Honduras are the Pfizer, the Moderna, the AstraZeneca, the Johnson & Johnson, the Sputnik V, and the Sinovac. And currently approved or licensed COVID-19 vaccines are safe and effective and reduce your risk of getting seriously ill. Vaccination can reduce the spread of diseases and help protect those who are vaccinated and the people around them. Current vaccines are expected to provide protection against serious illness, hospitalizations, and death due to Omicron variant infection. Vaccination combined with biosecurity measures is the best strategy to reduce the transmission of COVID-19 and save lives.
Hello, I'm going to talk about triage and its importance. Triage is a process that enables us to manage clinical risks in order to safely and suitably handle patient flows when demand and clinical needs exceed resources. At present, triage systems that are employed are structured according to 5 levels of priority. Levels are allocated according to the concept that what is urgent is not always serious, and that what is serious is not always urgent. This makes it possible to classify patients according to degree of urgency, so that the more urgent patients will be attended to first and the rest will be re-evaluated until they are seen by the doctor. Some advantages of the application of triage is that it provides information to the patient about their status and the approximate waiting time. the most urgent is treated first. It reduces service congestion by improving patient flow. It allows the reordering of resources in the emergency area based on demand. Promotes the development of policies aimed at providing stable resources to the emergency area based on the severity and type of cases seen. Triage is a tool that seeks to improve the quality and efficiency of emergency services by establishing scientific and consistent criteria on the need for care that the patient presents with respect to their care demand. The importance of triage is that there are people who, if they are not treated promptly, suffer complications that can put their lives at risk. In these cases, triage gives them the highest priority. On the other hand, those who can, without compromising their general condition, are momentarily left in the background. Typically, triage is applied when a health center has a massive demand for care due to a catastrophe or an emergency. The coronavirus pandemic has collapsed hospital emergency services. In these circumstances, the triage process is essential to identify the most serious patients and optimize health resources.
The health system was on the verge of collapsing many times during the COVID-19 pandemic. We had hurricanes at Honduras a lot along the way, and today, due to the efforts of all Hondurans, we have begun to get out of the most difficult moment. Many deaths daily before the vaccines. There did not have rooms to treat the people who were seriously ill. It was very difficult to try to be positive, and at the time, many patients, few doctors, and urgent future made everything a very difficult moment. Today, we are stronger. We are aware of the disease that we did not use before, and now we know how to take better care of our sick people. Not everything is perfect. The health system needs to grow, hire more doctors and nurses, invest in more medicines, and improve our hospitals. The first steps we've taken, but there is still not much to do.
I will talk about the difference that the health system presents in each year during the pandemic. It is well known by all the mismanagement that has been given in Honduras to the health emergency caused by COVID-19 that began in March 2020, and that corruption does not stop even when the life of millions of people are in play. The government spent millions of dollars buying mechanical ventilation. However, by June 2020, only 20 of 714 had been reserved. In addition, the ventilators were incomplete and therefore unusable, and unfortunately, some people had already died because they did not have this equipment. In 2020, we could see that health system tried to give its best, but with the lack of resources offered by the country, it was difficult because the supposed funds for mobile hospital were not seen, since two of them could not be used for that they did not have the necessary equipment, and the remaining 5 were still being manufactured. Meanwhile, the health system was collapsed because there were thousands of infected. By 2021, there was a relentless increase in COVID-19 cases. In institutions such as El Torres Hospital and many other triage centers, they were 90% of their maximum capacity, and COVID-19 patients were in a serious condition. Although there was a total increase in infected patients due to the lack of prevention by the population, that resulted in a critical state of contagion for the months of July and August. The despite this, the health system was still said to be deficient, and there was a shortage of water and demand for health personnel. By 2022, it is perceived that the health system is a little more prepared and more knowledgeable to prevent deaths in COVID patients. In addition, since the majority of the population already has vaccines, the effects of COVID and its variant have been minimized.
In conclusion, the health system was not ready for the COVID-19 pandemic in Honduras. In fact, no country was really prepared, not the United States, or China, or Europe. It was an unpredictable to unknown virus that fear was upon us, and with the time it's that we have learned to overcome this daily disease. So it's important to know that our health system has done everything possible despite the inconvenience caused by corruption in the Honduras government and the indifference of the population at times. The vaccination campaigns are still going on, and currently many boys and girls are close to returning to their classes in the schools in a normal way. Investigations give hope of returning to normality soon, and research continues to improve the treatment of the disease and avoid deaths in patients with the virus. But we still have a long way to go, right? That's why we must continue to be careful for ourselves and our loved ones and still get together. Avoid a space with many people. Always wear a mask and wash our hands frequently. This will help us overcome this crisis as soon as possible and move forward. Thank you very much for joining us. We are group number 3, and this is the health system in Honduras after COVID-19. Bye.